Some of the exciting discoveries that we've had in our research, we've shown that if you prepare kids and families properly for surgery, not only are kids less anxious and parents less anxious, but kids have less pain, they recover better, and they're discharged from hospital more quickly. Pain is a difficult thing to assess at all in kids. Kids sometimes use different words or can't communicate in the same way that adults do. And the first step in managing pain is knowing when kids have pain. So it's really important for us to learn how to recognize pain in kids so that we can treat it. Our team uses medication strategies, physical strategies, and psychological strategies to help minimize the impact that pain has on kids' lives. Our plan is that our research will make a huge difference in the way kids and families experience surgery and help kids and families cope better with anxiety and with pain. I enjoy the fact that kids have so much energy all the time. Kids have a lot of resilience, I think. Kids tend to get through things that us as adults would have much more difficulties getting through. I like asking questions that make a difference to the way kids and families are treated. And I like being able to answer those questions with research and then apply the findings of research into actual clinical practice.
The focus of our research is looking at personality in relation to mental health difficulties. In particular, we look at perfectionism and how it can play a role in problems like depression and disordered eating. Perfectionism isn't conscientiousness, it isn't being organized, it isn't being disciplined, it isn't being goal-focused. It involves a compulsive need to be perfect. And that need to be perfect is often destructive for people. It's associated with resiliency, it's also associated with vulnerability, and over the course of a person's life, it probably puts them at risk for negative outcomes. It's an extremely common difficulty that many people struggle with in their day-to-day world. There's a synergy that occurs between the clinical research I do and the clinical practice I do. I'm a clinical psychologist, so I'm often helping people struggling with issues of disordered eating or issues of depression, and I can directly apply the research that I do to helping actual people with actual problems. At the same time, I find that I learn a lot in collaborating with others in assessment and therapy and in treatment. I have a wonderful job in that it permits me an opportunity to ask and answer questions that are deeply meaningful to me. It provides me with a direction for my creativity. It provides me with an opportunity to help other people. In the future, I want to continue to lead my research program so that we become the best perfectionism research lab in the world.
There's two things I really like about physics. One, I've always really enjoyed math. And physics is a direct vessel to apply math to the real world. And two, it's just physics in general covers a huge range of things, from planets to cells to electrons and metals. I love that it's so widely applicable. The idea that you could do calculations, use math to make such accurate and precise predictions about what's going to happen in the real world. Just stuff as simple as if you drop something, you can find within a millisecond how long it's going to take to hit the ground. That's interesting to me. Dr. Van Zyl and I mostly been focused on looking at few-body phenomenon. Most physics, especially condensed matter, you want to look at a huge number of atoms. Dr. Van Zyl and I tend to only look at 2 or 3 to get an idea how we can gain insight into these many-body systems. So if you look at 2 or 3 first as a building block, it can usually give you a lot of insight into the many-body physics as you add more and more particles to your system. At the fundamental level, it's just, there's a certain point at which it's just very cool to me. Like, people can actually pick these things that are so tiny we can't imagine and say, I have 2 of them trapped in there and study them from there.